Now, please welcome your host for Her Health Advantage, Dr. Jessica Shepard.
Hello, everybody. Good morning, and thank you so much for taking the time to be here. I'm Dr. Jessica Shepard. I'm based out of Dallas, Texas, which is a little bit hotter than here, what we have today. I'm a board-certified OBGYN women's health expert, and also the chief medical officer for Verywell Health, actually based here out of New York City. So we have an exciting event for you today. We really want it to be interactive and for you to really learn, ask questions. So if you'll see, we'll have later here a QR code that you can click on that to submit your questions, because that's how we'll get the questions that we can ask our panelists. I want to thank Hologic and WTA for really taking this as a forefront focus. This is so important that we have these discussions, that we really provide answers for everyone to answer their own questions and also to bring to their friends and family, because women's health is so very important. So why are we here? You heard from the video that we just watched that we do have a long way of improving women's health and really allowing ourselves to understand why it's so important and having the answers to the questions that many of us hold on to and don't know who to ask for those questions and getting those answers. So the panelists that you'll meet today are not only outstanding, I might say myself, but are really working hard to bring that improvement to the community and in our homes. So during this event, which you'll notice that it's called Her Health Advantage. We want you to be interactive, meaning take lots of pictures, make sure you post it on Instagram and Twitter and all of the things. But you're gonna learn why here today it's more urgent than ever to make preventative care more of a priority, especially when it comes to women. So we're gonna hear from healthcare professionals, but we're also gonna hear from tennis champions, also noting that it is the start of US Open. Clap for that, yes. I'm very excited. I think I said it last night at dinner. I said it this morning to Martina. I also am a tennis player in my head. And no one really watches me. No one really cheers for me because it's just a bad scene. But I am a tennis player. So we want you to use this kind of hallmark of sport when we think of the US Open and getting motivated more than ever to make your health a priority. Make sure that everyone here has scanned the QR code on the screen. Yes, make sure you want to make sure that you scan that, because that's how we're going to get your questions. We're going to ask you questions as well. We're going to have some live questions that's going to show the answers. And we want to make sure that you know all answers are anonymous. So it's not going to tag you and tell who answered this question. This is not like grade school where you have to raise your hand and then you get told that you're wrong. But we want you to use that open Q&A button that you'll see through this in order to send the questions. And don't forget to hashtag Her Health Advantage on all your posts today. Her Health Advantage is the hashtag. That's what we're using today. So let's get started. Our first panel is going to be serving up insights on women's health. So first, I'm going to call up our breast imaging expert and VP of Worldwide Medical Affairs at Hologic, Dr. Susan Harvey. And next, we have our sports medicine expert from Mayo Clinic, who works closely with WTA athletes, Dr. Jennifer Maynard. And psychologist and manager of Global Clinical Diversity, Equity, Inclusion, and Belonging for WTA partner, Modern Health, Dr. Jessica Jackson. And last but not least, we have an icon. We have someone that everyone in this room knows and has won 167 singles and 177 doubles titles during her WTA career, and an all-time record for any player, male or female. She's an outspoken advocate for women, as you know, a breast cancer survivor who shares her story very openly, and in order to encourage women to put their health first. Please welcome a true champion, Martina Navratilova. All right, let's get started.
All right.
As we've seen from that video that we showed, and many of you know that challenges that women face in getting quality care and culturally relevant preventative care, but there was no substantial effort to gauge the status of what that really meant. And the women's health worldwide until the Hologic Global Women's Health Index. So this was created by Hologic and the Gallup annual survey, and it's actually the world's most comprehensive study of women's health. And it represents the views of 94% of the world's women and girls. 122 nations were actually surveyed across the world. So when we look at that, you can see that we have, some work to do, but this is allowing us to really capture that. So I have a question for you, Dr. Harvey. The preview of the second year of the Hologic Global Women's Index, before it comes out in less than a month, what are your thoughts on that?
Well, first, thank you for the question, and I'm delighted to be here. Thank you all for coming. The second year of the Hologic Global Women's Health Index shows us unique data. It is from the perspective of women and their experience as well. And it's really critical data. So what I'll do is just summarize 3 topics. The first is, shockingly, 1 billion women. That's 3 times the US population. Men, women, and children, 3 times the US population, didn't even have an opportunity to speak with a healthcare provider in 2021. And I worked for 30 years clinically in breast imaging. I had the latest technology for detection, diagnosis, and treatment. And healthcare is still a journey, and it's still an incredible challenge, even with all of those resources. How is it that these women are facing their health challenges, including during times of pregnancy and delivery, without even having the opportunity to see a healthcare provider? The second important piece of information was that 2.3 billion, so that is almost twice the population of China. That is a huge number of women. Were not screened for any type of cancer at all in 2021. Not any type at all. And I can tell you personally, being a person who lives with stage 4 lung cancer, that the opportunity to screen and have early detection makes all the difference. I didn't have a screening till I was in high risk. So I didn't have those opportunities for early detection and treatment that is both easier, less costly, and far more successful. And the same thing is true for blood pressure. A small number of women were tested for high blood pressure. Cardiovascular disease is the biggest killer. And also for diabetes, a very common and growing disease. And very few women were tested. And finally, sexually transmitted infections and diseases as well, related to HIV, cervical cancer through HPV. We were speaking about this earlier. And also HIV. So it is, it's an incredible thing that we are failing women in preventive care. And the third very important piece of information we found was that the gap is increasing. The gap between rich and poor, high income and low income. And what this is doing is it's creating even greater inequity in healthcare. And I can tell you, having grown up in a rural area with very few resources, that I understand, even in that small bit, the stress and the worry and the sadness that comes with that. And it is a huge, huge challenge. And I know we'll have time to speak about emotional health in the future, but when women are focused on providing food and shelter for themselves and their families, there's no room for healthcare. There's no way to prioritize or even think about it at all. So that's what we found. 1 billion women without even speaking to a healthcare provider, 2.3 billion women without being tested for cancer, and increasing gaps around the world between rich and poor.
I think those are very important aspects that you bring up. Is one, there is a lack of access, but two, I think the conversation is a big part of that. There are many times that we do have the access or resources, but there's stigmatization that goes on with that, or the socialization of how we view ourselves or how we may think others view us when it comes to some of these topics. So, I have a question for you, Martina. You're up on the chopping block. Yes. Dr. Harvey, talked about the disconnect that we see between the need for preventative care and how too few women are really getting that care. What was your health situation like specifically when you were diagnosed with breast cancer, and how did you react?
Well, so my health situation was great because I did not know I had it. And as it turned out, it had been 4 years between my mammogram. I moved cities, not countries, but cities. And I just thought maybe it was 2 years since my last one, and it had been 4, and I did not realize that until what hit the proverbial fan. So I had a mammogram in January, and they called me back in Aspen. My best friend is an OBGYN in Aspen. We play hockey together, and so I had my mammogram, and then they called and says, well, we need to get another one, but get a closer look. Australian Open comes up. I'll do it after Australia, no big deal. So after the Australian Open, I go back, and they said, well, we're not sure. Maybe we need to do a biopsy. Okay, biopsy. As he's doing the biopsy, I'm laying on this coldest table ever, upside down, and they're digging in there. He says, no, it looks good. So I'm still thinking everything's fine. This was a Tuesday. Wednesday, I get the call from my friend Mindy. It's positive. And first positive. Oh, positive's good, right? Oh no, it's not good. So I cried for about 30 seconds, and I'm like, okay, what do we do? I got into the solution right away, and so Mindy says, I'll drive you to Denver tomorrow, and we'll find out. Found out it was DCIS, carcinoma in situ, but stage 3. It was not good, or the highest grade. So I found out I need a biopsy, and then radiation maybe months later, and so I had the good cancer, if there is such a thing. Talk about an oxymoron. But anyway, so I was shocked, obviously, and felt sorry for myself. But again, I got into the solution right away, and was lucky enough to get the biopsy. What I could not believe is how, so Thursday I get the good diagnosis, and Thursday night we have hockey practice back in Aspen, and I'm playing, and I'm so tired. I'm like, what is wrong with me? I stopped hockey practice. So next day I play tennis. I'm like, I'm exhausted. What is wrong with me? And then I realized the stress from finding out what's going on with me, even though it absolutely did not affect me. And it was about 2 weeks before I was back to normal physically, just from the stress of finding out what happened. So then I had radiation during in Paris, and played the Legends, and was able to fit it all into the schedule. But I was going to be quiet about it. But then number one, that was difficult, just to lie or not say anything. And number two, I realized I have a chance to speak out and let women take care of themselves better, because we don't. You get that thing in the mail, oh, your cat is ready for a rabies vaccination. We take him the next day. The dog, same thing. But you get that thing, you do for a mammogram, okay, I'll get to it next week. And before you know it, a year has gone by. So yeah, it's just being aware. We're just not aware. And we take care of everybody else.
So like you said, you wanted to maybe not talk about it, but you did, and which is very helpful, being an advocate and sharing your story. I think, with someone with your platform, people really do listen to you more. I was saying that earlier, is like doctors, we say things day in, day out in an exam room, and then someone else says the same thing that we said, and they're like, yeah, what that person said. And we're like, well, we've been saying that, so it's good.
And it was, and I got a lot of letters and on Twitter, and then people on Meet says, you know what, because of you, I went to get a screening, and because of you, we found out that it was not okay. So, but even if they were okay, great. Now we have peace of mind. But a lot of women had issues that they forgot.
So we do thank you for using your platform and your voice. From the stories that you've heard from others, what have you found that they've shared of maybe some of their barriers to either getting testing or being preventative when it comes to in the instance of breast cancer?
Well, so much of it is we're just too busy. We don't think about it, and so much of it, particularly in this country, is money.
Yeah,
You know, it costs money,
Yeah.
and it's not covered. Now I'm covered. I'm 65, so I have Medicare, Medicaid. Thank you very much. Although I'm, but it's tricky. So it depends on the situation. But for most women, it's either or. It's either money or time or both.
Yeah, I think there's a lot of emotional burden that women carry and create some of that distance between going in for the testing and then maybe not wanting to go for fear of what the diagnosis may be. Dr. Maynard, you are up. I have a question for you. Working with all these WTA athletes, from what Martina was sharing, what have you seen maybe some of their stories in struggle, obstacles, or even triumph when getting tested for certain things or wanting to maybe take the next step with screening and preventative health?
Sure. And again, thank you for having me on the panel. Very, very happy to be here. Working with the WTA athletes, I mean, these are professional tennis players at the height of their careers, and they're traveling. So again, time, as Martina mentioned, they're traveling 40 plus weeks out of the year. And, you know, they don't really have time because of that to find a medical home. So that's a primary care physician that can help coordinate a lot of these screenings. So, you know, time and travel is a huge barrier. And also, I mean, the WTA athletes represent over 87 countries. And so there's a lot of different cultural beliefs and practices that we, of course, respect. So WTA has really taken a step forward, and one of the best that I've seen in professional organizations, to bring the healthcare to the athletes.
Right.
So we are able to do comprehensive multidisciplinary physicals, hopefully moving to annual, where we bring specialists from all over the country and all these different specialties, from sports cardiology, sports dermatology, sports nutrition, mental health, orthopedics, and they do some functional movement screening, and then they come see me. And I'm the primary care doctor, and so no topic is off limits with me. And this is where we get into the female health aspect, and we talk about the menstrual cycle and some more taboo topics, but really shouldn't be taboo, because I really like to think of the menstrual cycle as kind of a barometer of health for these athletes to make sure that they're getting proper fueling. And we talk about breast health, and we teach them to do their own breast exams, or I will show them how to do them on themselves. And it's because most of these athletes are under the age of 40 when we start annual mammograms. It's all about finding that self-breast awareness so that they're able to detect something if they're in the shower and they're washing themselves and they say that wasn't there last time, and so that they can bring that forward for further evaluation. And then we talk about the gynecologic health side of things too, with cervical cancer screening, HPV vaccines, sexually transmitted disease screening. We talk about all these things, and the goal eventually is to actually have that as a part of the physical if they opt to do so.
Now, furthering that question, being an OBGYN, I'm just being a little greedy with the questions here. We've had a few WTA players who have stepped off, the court to have a family, start a family, raise a family. What would you say from the WTA perspective? How is that support for those players during that time? I think we do live in a country where we are constantly talking about maternal health and then also return to work. In this case, it would be returning to the court. How does the WTA support that?
This is another area that the WTA truly excels, and they really support these athletes in starting a family when they think the time is right. It does not have to be at the end of the career; it can be mid-career. And they support them to take the time off during pregnancy and then the time after pregnancy to help raise an infant. Let's face it, that takes a lot of time. But then to make sure their body and their mental health, their physical health is ready to come back to the court in competition level. And we have 4 athletes in the top 100 singles that are moms. We have 5 athletes in the top 100 doubles that are moms, and 7 Grand Slam titles won by moms out there. And it's so awesome to see those little ones cheering their moms on from the court too. And they make it look easy. And as a mom, I can say I know that's not easy. Right. So kudos to them for sure.
I know. I'm just imagining coming back to playing a sport like top level. Yeah. That really is some fortitude and dedication.
Absolutely.
Going back to you, Dr. Jackson, I wanted to know, what do you feel about, before we do that, we're going to do a live question. Everyone ready for a live question? Do you have your phones out? The pressure. We can't talk about women's health without talking about emotional health. So we have a question for you. So take a look on your phones. And did you guys get all the QR code? Yes? Okay, so did you experience, this is just like out there, doesn't matter what your answer is, they're all anonymous. Did you experience any of the following feelings most of the day yesterday? Worry, stress, sadness, anger. So did you experience any of the following feelings most of the day yesterday? So plug in your answers and let's see what we get.
I think we should answer too.
So you can see we're having a little tug of war there between worry and stress.
I want to know what people are pissed off about. I had stress. It was very momentary because I was flying yesterday, and the landing at LaGuardia was not fun. That's when I started.
So you're been on the anger.
It was a pancake, man.
So as you can see, 44% of us were stressed. And that can come in varying degrees when we think about stress. It's never just one way that we experience stress. So as you can see, we are pretty stressed in this room, or were yesterday, but we've resolved that, right? We are just have no stress right now. But here's how women across 122 countries responded to the Hologic Global Women's Health Index in 2021. During the previous day, 43% were worried, 41% were stressed. So actually we're pretty close to the rest of the world. We were at 44%, and 32% expressed sadness, and 26, wow, they were a little bit more angry, Martina. They were 26% felt anger as opposed to 11, which is what we had today. So these are record high levels going back more than a decade. Okay, so this is kind of looking at, as far as the global index, looking at women over the course of a decade. So we have some work to do, and I think that we have the tools and the resources. We just need to have more conversations which allow us to explore those tools. So now I'm going to ask you a question, Dr. Jackson. Women around the world clearly have a lot weighing on their minds, and this also feeds into, when we have things that are weighing on our mind, how we deal with our health and how we're able to address any health issues or concerns. What preventative care resources and approaches can help us really deal with the emotional and mental health aspect of our daily lives?
Well, I think it's a good question because we don't think a lot about prevention when we think about mental health. And so we normally, what I've seen is wait till we're in crisis and then we're like, I need to go and speak to someone. And so one of the first things I think that we can do is just acknowledge how we're feeling. Women particularly are socialized to always be okay. And so we don't even acknowledge for ourselves that I am stressed out about this. I mean, Martina shared, it took her, realizing that she was tired to say, this is impacting me. And that's what we're socialized to do. So I think one of the first things we can do for prevention is learn emotion words. I tell everyone, you can download a feelings wheel online. Learn how you're feeling. We can't address a problem without knowing what we're addressing. And so many of us only know a few words. We know anger, we know sadness, but we don't know words like, I feel shame, or I feel embarrassed, or I feel frustrated, right? And so then we're trying to address a problem that we haven't identified. I think the other thing to add is working with your healthcare providers. Like at Modern Health, we use a stepped care model. You don't have to be in crisis. So maybe you might find digital resources. So maybe you're doing a meditation or mindfulness online, or maybe you're working with a coach before you see a therapist. Maybe you're using your friends, you're talking to somebody. That's prevention, right? It's not keeping it all inside, it's just even talking to someone.
I think that's important. And actually, anger is like not a true emotion. It's a response to how we feel. But many of us don't know how to even start to label how we feel. And that's why using words that we saw in the previous survey are very important, because worry can be different than sadness. And using those words in good context, and then finding the way to get the help for what we need and using those tools and resources. So we kind of alluded to it in the answer that you just said, but do you feel that many people don't want to address some of their emotional and mental health issues because of the stigma that is attached to it?
I would say yes. We have also, as everyone has been socialized to have qualifiers for our emotions. So we'll say this is positive or this is negative. Emotions are data. That's all they are. It's like, this is how I'm responding to something. We have to notice it. And so I think that we do have a lot of stigma because we're also socialized that vulnerability is a weakness instead of a strength. And so as more and more people, you'll see it generationally, a lot of our younger Gen Z, they're talking more about their mental health in the workplace with their friends online. I mean, you've seen the explosion on TikTok of how many people are talking about mental health. So I think that the stigma is decreasing, but we have a long way to go. And I mean, I think the report by Hologic is really important because you think about since I think it was 1989, that was the first time that NIH, the National Institute of Health, started to mandate that women even be included in research, which is a huge thing, right? That's 30 years ago.
Right.
And so when we talk about stigma, that's a part of it. We weren't even being included in the conversation.
What else is new?
Martina, I wanted to ask you another question here is, going through that journey, with breast cancer diagnosis and then after and being an athlete, but not only just from an athlete's perspective, just from being who you are personally in your day-to-day life, did you find that you had the resources that you had to deal with the emotional and mental health aspect of a clinical diagnosis?
Yes. So, yes, I did have the resources, and my woman that I used to see for emotional reasons, a clinical psychologist, said it's important for you to surround yourself with people that are supportive of you. So at that biopsy in Denver, I had 7 women with me. I like the biggest team there, and so I'm the person that always wants to help, but I don't ask for help. But she said, you need to ask for help, and it's okay to do that. So I did, and I was bathed in love and support. But I was lucky. So, but we're so trained to take care of ourselves that we don't ask for that help of others, and we're always helping everybody else. So I was very lucky in that. And what I learned also is to walk away from stress. I kind of, when I get angry, I blow up, but I'm done with it. I walk away, but a lot of people cannot do that, or they don't know how to do that. So I always walked away from stress. But with this, I realized how much stress impacts you physically, as well as emotionally, of course. And so now I just don't I literally can't change it. I don't care. If I can fix it, great. If I can, then I don't worry about it. So just learning to walk away from that stress and not worry too much.
As you've heard today, we've heard not only the statistics of how women are being missed from, would you say 3 billion or 2 billion?
1 billion women weren't able to speak with a doctor.
Not even to speak to a doctor.
Not even to speak.
Those numbers
with
are
a doctor.
staggering.
Yes.
I didn't even realize it. I think sometimes you need to hear something over and over again for it to really resonate with you. But there are so many women out there who don't even have the opportunity that many of us have in this room today. And so I hope that would only encourage you even more to be preventative with your health in the aspect that we've heard from Hologic, giving us a beautiful display of how we can do that in different facets of our life. And Dr. Maynard, you spoke about working with WTA athletes and how their health have impacted both their ability to play on the court and then how that impacts them off the court as well. So thank you for your work and what you do with athletes. And Dr. Jackson, thank you for giving us the emotional tools, or the tools that we can use for our emotional mental health, and always making sure that we intertwine emotional health as part of our overall health. Martina gave us a great instance in when your physical health is impacted, how that can shift to your emotional health and how they start to play on each other. And sometimes we're not able to realize that. So being able to pull them apart and address both of them for what they are. And Martina, thank you so much for being an advocate for not only your health, but sharing your story, which allows us to magnify that for other women to go do what they need to do when we're talking about screening, when it comes with mammogram or STI screening. All of that is important because our longevity and our quality of life is really impacted by how we take care of ourselves before we get to that diagnosis. So thank you so much. I hope you'll agree with me that the panelists have given us so much to think about, and more importantly, to now go act on. So thank you again, and thank you to the audience for your ability to be here and share with us. So we have some questions from the audience that we're going to share. I think we're going to do 2 questions here. Let's see. So the first question here is the info you're presenting is alarming. This is 2022. I like the way that was stated. That was almost petty. They're like, this is 2022. And we still have these alarming rates of information. I wanted to ask you, all of you, very quickly to say, are we making true progress when it comes to women's health, hearing what we've heard from the statistics? Not all at once. Go.
Absolutely. We are making progress.
Great. That's good to hear.
I think we're making progress, but we need to make more.
We do.
I think it's progress just that we're having the conversations and we're doing them in public, right? Normalizing that these are things that we can discuss with anyone.
Speak up when we can. Because when we're quiet, like, what was this quote? Well-behaved women don't make history. You speak out. We have to be heard. Men's voices validated immediately, right away.
Yeah.
Women's voices, we are worried that we will not be validated, so we don't say anything. So speak up, and it's great to be in that conversation. I mean, even shoes. Most shoes are made on men's last. And we've had issues for the athletes, for the women athletes, because women's feet are different from men's feet. But they're made of men's last, just smaller. No, that doesn't work. So part of the conversation now, about time.
Yeah.
Yep. You've got to speak up. And we have one more question that we're going to have here. Have you ever been subjected to a healthcare provider who didn't take your medical condition seriously? If so, how did you deal with it? Any of you have that happen to you?
I had a situation once.
Yeah.
So I'm a psychologist, and I went, and I have a autoimmune thyroid disorder. So sometimes you have trouble with sleeping and different things. And so I went to see my PCP. It was a new PCP, and they insisted it was mental health. And so they kept telling me, and I was like, I'm a psychologist. I would know. And they're like, no. Do you
Maybe they saw that on your chart before. They're like, well, make it a mental health issue. So
They're like, do you want a referral to psychiatry? And I'm like, no, I'm telling you. And so they offered to give me the screeners, and I was like, I know the screeners by heart. And so I actually had to tell them, like, well, then you need to document that you're not listening to me. And it turned out when they did blood work, I had low iron. So it had nothing to do with mental health, but they were like, we're going to send you over to psychiatry because you're saying you're having sleep issues. And it's one of those things where I really had to, like you said, well-behaved women don't make history. I really had to have a voice and say, well, then make sure you write down that I asked you to look into it before you send me somewhere.
Yeah.
I like that. You challenge the system. And look, you got an answer. I like it.
My coach, Mike Estep, used to have a great quote. Remember that 50% of doctors graduated in the bottom half of their class. So
None
ask
of them are
questions,
here.
Get
None of
second
them are here.
opinions, and speak up for yourself. Don't be afraid to ask more questions, or go to another doctor. Don't take their word for it.
She's like, and I don't care that there's 3 MDs up here. I don't care. I'm gonna.
But these guys were not at the bottom of their class. I guarantee you that. Because number one, they're women.
There you go.
They had to work their ass off.
I was saying earlier, there comes humility, even from a physician standpoint, in being able to say, I may not have all the answers, and maybe I'll send you to someone who might have an answer. And in the same way, I challenge my patients. I'm like, I am an advocate for second opinions or even third opinions, and I want you to be, in charge of your health and feel that you have some agency over what decisions are made for you and that you're a partner in that. So I wholeheartedly love that. Thank you for spicing that up a bit. I'm going to go home and think about myself for a bit. But thank you, Dr. Harvey, Dr. Maynard, Dr. Jackson, and of course, Martina, thank you so much for being here. We've got another panel that's coming up here in just a minute, so stay where you are. Today, we're not only identifying challenges, which is what we did with our first panel, but we're going to also offer solutions. Not only are we going to make this conversation about what we may all share together in our struggles, but we also want to make sure that you know that there are solutions. So please help me in welcoming the president of Hologic's Diagnostic Solutions Division and an expert on testing for cervical cancer, Michelle Garsha. And next, we have the VP of Performance Science for WHOOP, the WTA's official fitness wearable partner, Kristen Holmes. And now we have 2 of our most exhilarating athletes and who are also rivals, but also very close friends. Both have been very active on the WTA Players Council, and both have established charitable foundations that give back to their communities. Let's give a round of applause for WTA superstars Sloane Stevens and Madison Keys. They're choosing seats.
Just pick one. Okay, I'll just go. Hello.
Hello. How are you?
Great.
Yeah, everyone's good? All right. So we have an exciting panel here of solutions. You have all your solutions ready? Yes? Okay, good. All right, Michelle, you oversee the Hologic division that is a global leader in screening for cervical cancer, also sexually transmitted infections, vaginitis, and vaginosis, all conditions that have a significant impact on women. How are you getting women and their healthcare providers refocused on preventative care? And also thinking of the pandemic over the last 2+ years, we've had kind of maybe some moments of pause in what people were able to access. How have you really been able to reshift the focus back to screening and preventative care?
It's a great question. Hologic, we develop innovative medical technologies, many of which are focused on women's healthcare. We partner with healthcare providers to try and, ensure that they're aware of the latest technologies, and we really try to advance policy that helps to bridge the gap that unfortunately exists between men's healthcare and women's healthcare. Mm-hmm. COVID, though, has been a time that changed life for all of us, and it's certainly been a challenge, but at the same time, being part of Hologic, we really responded to that challenge with what I would consider grit and tenacity. And one of the things we did was become a global leader in COVID testing. Mm-hmm. So the PCR tests that you hear about, we have provided more than 200 million of them since the beginning of the pandemic. But at the same time, we really doubled down on our efforts in women's health. And we wanted to connect women and in some cases maybe reconnect women with the preventative services that they really need. And so we've been talking about the Global Women's Health Index, and that's been a critical component, I think, for healthcare for women in the future. And we see that as foundationally a platform for action globally to prioritize healthcare for women and also to ultimately provide more access worldwide for women who often don't have access at all. We've also spearheaded a project called Project Health Equality. That's really focused on the underserved populations in the United States. And, there just are so many women without access. And so one of the things that we are doing is providing some services like breast cancer screening, mm-hmm. like Pap screening for women in these populations that don't have that access. We're doing a lot of education, but I think one of the most important components of this project specifically is education. It might seem straightforward how to improve care for underserved populations, but it really isn't. I mean, the research that we are doing is uncovering ways that, we can really bring actionable solutions that will ultimately improve outcomes for these patients. And so that's a really big part of that. But we've also been focusing on driving awareness. I think that so many women need to be reminded, especially at this moment in time during COVID, that prioritizing your own health and prioritizing preventative services is so critically important. So we partner with people like Mary J. Blige, and mm-hmm. I don't know if all y'all saw our Super Bowl ad with her, but it was very cool and an exciting time to be part of Hologic. But we also partner with Sierra, who is another staunch women's health advocate, Oprah Winfrey Network, and then, of course, this partnership with the WTA. It is just so important to have role models like Martina, who was just up here, and Sloane and Madison. Their ability to motivate and influence women to take control of their own health is something that we are really proud to be part of and excited about.
I love that you kind of bring that to the table of how many platforms that Hologic has sought to raise awareness, because many times women want to take their own health and make it private, whether it's just fear of what the diagnosis might be or sharing that information and also the stigma that goes with it. Now, you were talking about the pandemic and all of the tests that you guys developed and also seeing that shift in preventative care. Now, you have long days, so I want to know what you do for your own personal and physical health to kind of keep the status quo of some type of peace?
Yes. I think I fall into the same trap as so many women, that we all have a tendency sometimes to prioritize other things over ourselves, and been focusing hard not to do that. But for me, the operative word is really balance. It's ensuring that I'm trying to maintain balance, and that balance shifts over time, but really aspiring to do that. And I would say when I was younger, I was focused on the body aspect of mind, body, spirit, and they're all so critically important. So eating healthy, exercising, the obvious things to stay healthy. But as I've gotten older, and what Dr. Jackson was up here talking about resonated with me so much. It's the mental health aspect of things, and the practice of mindfulness and meditation, and how that's really helped me to stay grounded and centered in a pretty stressful job and a stressful life, to ensure that I can show up in my life the way I want to, for the people that I love, and for my job. I have to do that to stay balanced. I guess the last thing I would say, and I'll be a little vulnerable here, is that I have a busy schedule. I travel a lot. And the part of my life that's hard to prioritize is a consistent exercise routine.
I'm going to partner with you there, yeah.
It's really hard when you're in a different time zone and a different schedule all the time. So that's, be vulnerable. I'm still working on that side of things to make that a part of my life. But if I can get on my soapbox a little bit, because you mentioned that I have been focused on cervical cancer for a lot of my career. There was some pretty shocking data that came out in the last couple of weeks that talked about the fact that in this country, cervical cancer is on the rise. And it has been declining for years. I don't want people to forget that cervical cancer was the #1 cancer killer of women.
Right.
And before the introduction of the PAP. And we had whittled it down to maybe number 14. And it's actually, we could eradicate cervical cancer, but 10 years ago, we extended the interval to 5 years between testing for women 30 and older. And what we're finding is 5 years so easily turns into 6 years, turns into 7 years. And that's just a hard time frame to keep top of mind. And so being really proactive in ensuring that you are going to your healthcare provider on a regular basis, getting your PAP, getting your HPV test, because the cancers that they're finding now are late stage cancers that are largely uncurable.
And, I just wanted to echo on that, being an OBGYN, is it's hard to be like, all right, see you in 5 years, remember me. And so we want to create more of a relationship with our patients and being like, I want to see you next year, whether you do need a PAP and HPV test or not. I want to continue conversation and all of the other things that have to do with your health. So I do think that's important. Madison, I'm coming down there to you. I want to build on the theme of emotional health and mental well-being. We've learned a lot from some athletes in various sports who are very vigilant about talking and speaking about this topic. What are some obstacles that you face personally in this space, and what management techniques, tips, or tools do you have that have worked for you and you'd want to share?
It's traveling. Obviously, it's really hard to constantly make that a priority. And I know I have a therapist that I talk to, but sometimes trying to get times that work when he's in one time zone, I'm in another, flights get delayed, practice gets messed up. So it's not always easy, but I do know that for me, it's such an important part to, not even just for tennis, but just for my life. It's such an important thing that I need to prioritize, that I'll jump through extra hoops just to try to make a time fit. And then I think the biggest thing that I've really started doing is I've started writing a lot, whether it's something that is consistently popping into my head. And I'm one of those people that when it starts bugging me, it becomes obsessive, where you open your eyes at 2 a.m. and that's all you can think of. So getting up, writing that down, trying to get it out of my head. But on the flip side of that, also when things are going really well, taking a moment to think, what am I doing? What have I been thinking about? What am I doing to put myself in this really healthy mindset? And I'm going to write that down, and I'm going to try to go to that when there might be times when I'm struggling a bit more or things aren't going quite as smoothly.
Real quickly, did you find that there was a time frame in which, as you just said, that it's very imperative that you find the time for it, where you made that switch? Because that can be difficult, introducing mindfulness and being very aware of your emotional health to making it the pattern of what you do every day or your routine. Did you find that when it was just like, yeah, I'll go to therapy, okay, maybe, until you were like, no, I need to make this a very important part of my life as a routine?
I actually had a really hard time after COVID going back to traveling for tennis, especially because we were going into countries that were still shut down, living in bubbles, not being allowed to leave hotels. And it was just a very drastic change from life before COVID and then being at home for as long as I was. I had a really hard time with it. It was something that I just couldn't handle, being in bubbles and feeling like I couldn't escape the constant pressure of tennis because it became my entire life. So in that moment, that's when I was like, I really need to talk to someone, because if I want to continue to not only do well in tennis, but enjoy what I'm doing, I need to figure out how to get past this anxiety that I now have every single time I'm going to a tournament.
Well, I'm glad you made that the priority, because clearly you can see how that's helped in your evolvement and growth over the last few years. So thank you for sharing that. Sloan, in June, you joined Vice President Harris at the White House to help her launch a task force that addresses online harassment and abuse, which is actually a very big part of what we see in culture now, of how we can actually attack people without even necessarily being in the same room or in the same institution. Social media is a very big part of our lives and undoubtedly taken over some of our lives and can have some pretty negative influences if we let it. One, do you face similar kind of features or pressures through social media, being a very public person? And what tactics do you use to filter out that negativity? Because we do know that social media has a very good positive flip to it, but then there's also going to be the negative side to that. And what would you have advice for people who do maybe have those negative impacts of social media, and how they may be able to exit some of that and keep that away instead of it letting be a big part of the interface that they have with social media?
Yeah, I mean, social media is such a... Oh, can you guys hear me? Sorry. Social media is such a broad spectrum of things. It can be so good. It can be crying videos of like really nice things happening. It can be family things. And then it can be bettors, gamblers, people that are not saying nice things. I think all of us, as athletes, Maddie included, we've gotten these crazy messages for years, and we have completely normalized being called names and death threats and I'm going to come to your house. I just found out your address. Like, we've completely just like desensitized ourselves to just being like, oh, this is a normal thing. This has been happening for the last 10 years. And I think last year when something, I don't know, one of the crazy things that happened to me, I said, Maddie, this guy has my address. And she's like, okay, let's tell the FBI. I was like, I'm like, okay.
That is the natural first thing that one would do, go to the FBI.
And for us, that's like so normal, right? Like have dealt with, being at the French Open and the FBI calling my mom and being like, there's a case going on, and my mom is at home freaking out. And I'm like, okay, now I'm dealing with my mom's freaking out, my freaking out. Like, there's just been so many, and then I'm putting my stuff onto Maddie. Like, Maddie, you won't believe what happened. So it's like a cycle, and everyone's interaction with social media is so different. Like, ours is obviously the social part of betting and gambling and our tennis and our sport. And so much of it is like family and like, the fun stuff, the enjoyment of it. And I think being able to separate, our work and our personal lives on social media for me has been super important, just because you can't help but see all of your tennis stuff. And when you go on your explore page, seeing people playing tennis and points and great points and this and that. And then it's like, okay, hate mail, then it's your cousin, and then it's hate mail again. And like being able to separate that for me has been super important. And I think last year after the US Open, just like sharing the messages that I did, those were like not even that bad, which is crazy. That was like the appropriate ones that I could post that were pretty extreme, and everyone's like, I can't believe it. I was like, oh yeah, this guy just like posted my address back to me and is like, I'm going to be there tomorrow. And I'm like, this is just not a normal thing, but being able to have a voice for people who don't really know what to do or where to go or even who to speak to. I even spoke to the head of Instagram, and he told me, okay, well, why do you open the messages? And I was like,
That's not the problem there.
Yeah, I was like, that wasn't really the issue, but okay. So I think a lot of it is just continuing to go forward to press for people who don't have the opportunity or the voice or the resources to reach out to the proper people. And then obviously talking to people in our space, like in our world, that are going through the same thing. Like Maddie's like my social media therapist, and like I have another therapist for something else and something else. And it's kind of how our life works, but for having the voice for people and kids, younger kids who don't have that voice or, feel empowered enough to say something.
Right. And I think it's important for both of you at the status that you have to share, one, that I do have similar obstacles that people who don't have a platform go through, meaning I get hate mail and people say really mean things to me, and being able to say, this is what I do in order to kind of compartmentalize that and push that away. In addition to social media therapist job that you have, Maddie, which I'm sure you just found out, what inspired you to start Kindness Wins?
Honestly, it was a bit of the social media madness that was kind of happening, and then it felt like, on top of getting personal attacks, and then in the tennis world, we all finish matches, and it's like Sloan said, it's so normalized to have horrible messages that we'll literally joke in the locker room and be like, oh yeah, this person said this, and it felt like there was just so much bad happening. That was kind of all that was getting talked about, that I felt like it was so important to not just shine a light on all of the good things that are happening, but take the time to thank the people that are doing that, all of those amazing things, because no one does, great things so that they get a pat on the back. They just do them because they're trying to be good people and help other people. But I think it's important to tell people, I see what you're doing. It's amazing. Thank you for doing that. And I think it not only inspires them to continue doing what they're doing, but it inspires other people just by seeing they did an amazing thing. Like, that inspires me to now go out and try to do something that I'm really passionate about.
It's like one good deed spurs another. Through Kindness Wins, are you able to empower younger women to live a healthier lifestyle?
That's definitely my goal. I think that not only is it, spreading kindness and the awareness of it, but I think it also trying to be kind to yourself is such an important thing. And I think as women, we forget to do that sometimes. And that's a very, very important step. So I think just trying to remind everyone that it's okay to take 10 minutes and say, I'm doing amazing. My hair looks phenomenal.
Yes.
Having a great day. I think that's just, when you're able to do that for yourself, you can go out and it just puts you in a much better place to be kind to other people. But I think that just helps the world, one, go round, but just be a little bit, happier and nicer.
I like that, being your own hype man. Sloan, you started Sloan Stephens Foundation. What inspired you to do that? And do you find that it allows you to utilize your idea of a healthy lifestyle and implementing that into the foundation?
Yeah, definitely. I started the next year will be our 10-year anniversary, so I feel so old. And last night we had our first event, and we were talking, and Lindsay said, yeah, we service 15,000 kids every year in Compton Unified. And I was like, wow, that's a lot of kids. So I think for myself, being able to give back an underserved and under-resourced community to a sport that has given so much to me in my life. Obviously, tennis is not the first sport we think of when we think of like easy access sports compared to like basketball and soccer, where you just need a ball. Basically, tennis, you need a coach, you need balls, you need a racket, you need a court. Like, there's so much, it's not like an easy process to play tennis, and being able to bring tennis to those communities where they wouldn't pick tennis as their first sport is super important to me, just because I grew up playing at a public park and playing with the coach. My first experience was incredible. So for me, making the first experience for these kids amazing and incredible, they will play tennis for the rest of their lives just because they had a really great first experience. And that brings me so much joy, just because I know that these kids otherwise probably would never choose tennis. And tennis has, like I said, given me so much in my life. And I've been blessed to travel the world and do all these amazing things. And through tennis, there are so many opportunities. So to be able to give them back the same opportunities I was afforded just only feels right.
Yeah, and then it also promotes activity and sport, and which then feeds into emotional and mental health. So it really is kind of this wheel or continuity of healthy living. I want some crowd support now. We are going to go to a question. Make sure you take out your phones, and we're going to use that to put in your answers. This is a quiz question. Yes. Again, they're anonymous, so if the answer is no, it's still fine. Were you tested or screened for any type of cancer in the past 12 months? Let's see our answers come in, and then we're going to look at the live answer board. So that can be anything from mammogram, cervical cancer, even STIs, pap smear. 50-50, yes, no. 52 no. Who took away their answer on yes? Okay, they're back. 49. Okay, we're even now. All right, so what you can see is, and this kind of goes to what we were sharing with the health index answers, is that we're still having some difficulty with getting the screening that we need or getting the testing that we need. And I think that really starts with education on why we do it and why it's so important, and then emphasizing preventative health as well, and not ever lightening the load or the conversation of why it's so important for cancer screening. Because when we do have a diagnosis that's early, and specifically for cervical cancer, we really have the ability to treat and possibly cure cervical cancer. So we know that every year there's a monumental amount of women who do have a positive screening going into more diagnostics. Every year about 17 million people are newly diagnosed and 10 million die from cancer. So early detection is key. Make sure you spread that information, one, for yourself and for others too. According to the Hologic Global Women's Health Index, only 12% of women worldwide were screened for any type of cancer in the past year. So this question is for you, Kristen. Statistics obviously are daunting. We know that. We've said that many times today. What can be done to prioritize our own physical and mental health?
Yeah, I think everyone on the panel has alluded to this in some way, shape, or form, but it really starts with awareness, right? We need to understand where to actually apply our effort. And I think that's where, a lot of the research that my team and I are doing is really to try to understand, when we think about mental and physical health resilience, what are the behaviors that actually underpin that? When we have clarity around that, we understand what behaviors to grasp onto. We are all extremely, extremely busy, right? And there's a lot of noise in this health industry telling us to do this modality, that modality. And I think at a foundational level, one of the areas that we've found in our research is that there is actually one behavior that I think we can probably say is the root cause to actually all mortality, and certainly one of the root causes of cancer, is circadian desynchronization. And this means when our internal system, our internal sleep-wake cycle is desynchronized from the external light-dark cycle. And it sounds so simple, but when these two are disassociated, our system is put under so much stress. And of course, I'm a part of a wearable company, and so I believe in data. But really, at a foundational level, these data help us understand where to apply our efforts. We can see how unstable our sleep-wake time, for example, is, which is the root of that desynchronization. If we can literally stabilize our sleep-wake timing, we can prevent disease. an unstable sleep-wake time is the root cause of pretty much all mortality, right? Like that is, to me, and we need to be shouting this from the rooftops. And people talk about spending more time in bed. They talk about sleep quality, but it really starts with stabilizing sleep-wake time, which actually begins the moment we wake up. You know, and all of the things, I'm going to tell you 3 things that can set you up for a quality night's sleep and enable you to fall asleep at a consistent time. And it's really about getting outside in the morning and seeing the sunlight. Even if it's cloudy, you need to get outside and view the light. That is what is going to get the cortisol going. Okay, these really critical hormones that are going to tell your system it's time to be alert. And what's really important as it relates to sleep is that once we get that pulse of cortisol, that then informs when we release melatonin later that night. And melatonin, of course, is the sleepy hormone that it's going to tell our body it's time to go to bed. So viewing light in the morning is so critical. And then really thinking about your feeding windows. We're not meant to be eating for 15 hours a day. 75% of Americans eat for more than 15 hours a day, which seems crazy, right? But if we can narrow our feeding
Are they just
window,
sitting at a table for 15 hours? Oh.
like just grazing, snacking?
Okay.
And you know,
was a little
digestion
worried
is so effortful,
Right.
right? It takes a huge toll on our system. So if we could narrow our feeding window to 8 to 10 hours and stop eating 3 hours before we intend to sleep, those are 2 behaviors that are pretty much available to all of us, right? That are going to make our system work more efficiently. It sounds really simple, but if we want to prevent cancer, this is actually a big place to start, okay? Because a lot of it is about gene expression and genes turning off and turning on. And without these simple behaviors, without this synchronization, our body just doesn't know what to do. We have to tell our body what to do, and it's these circadian influences around sleep-wake timing, light viewing, and we should be restricting light after the sun goes down. That's another big piece of this. Blue light blocking glasses, filters, really critical, and then really narrowing our feeding windows.
Okay, so now I have a question for the crowd. This was not planned. How many are doing maybe 2 out of 3 of those things? Show of hands. Maybe I'm like 1.7. Is that optional? Right?
Yeah,
I think sleep is probably my... I'm going to work on that.
Yeah.
But I think that these conversations are so imperative because now you have the tools to be like, okay, out of those 3 things, which ones could I correct or which ones can I really focus on in order to change my habits to have better outcomes? And then overall, when you're thinking quality of life or longevity, improve those.
Yeah.
So I love that. Thank you for giving me those tips. I love that you brought those tips and the data that got you to knowing those 3 things. How has technology played a part? I love femtech. So tell us a little bit about technology and how that's helped.
Yeah, I mean, what's great is that we don't really have to guess anymore in terms of the understanding the trajectory of our health. And I think that's where WHOOP is just, you know, of course I'm biased, but we actually just, a third-party validation was just released by the Australian Institute of Sport. And it basically compared WHOOP to Garmin and Polar and Aura and all these other devices. And WHOOP came out on the very top across all, So it's awesome. You know, WHOOP, we can say we're great all day long, but when someone else says we're great, it's even better. But I think, you know, now that we can understand we can track these biometrics that are really core to understanding how our health is trending. And, you know, one of those core variables is heart rate variability. If you don't know what that is, Google it, you know, look it up, put heart rate variability in WHOOP, and you'll see all sorts of really important information. And this is a great marker when we talk about mental and physical health resilience. Heart rate variability is very, very sensitive to our physical and mental perturbations. So when things are going wrong, it will manifest in our heart rate variability. So we have an incredible opportunity to just monitor this biomarker. Right? And we measure it very, very well. You can see it daily and you don't have to obsess about it, but it gives you a really good understanding of how you're adapting mentally, physically, emotionally, and spiritually to external stress. When we understand how we're adapting, whether that's functional or not, it gives us a place to start to take action. right? Because it's not a million things that affect our mental and physical health. Honestly, when we distill it down, it's sleep, it's recovery, it's hydration, it's nutrition, which sounds like a lot, okay? But those are the core variables. On the psychological side, it's do we have meaning and purpose in our life? Do we have a sense of autonomy and control? Do I have the resources to do what I need to do on a daily basis? These are the things that are going to move around our physical and psychological health resilience. And if we can monitor these things, and that's what WHOOP does, we monitor all of these things and we give you insights, real objective data on how these biometrics that we're tracking, that we say are important to track, that we know are important to track, how they correlate to your behaviors. So it's just a great opportunity to reduce the noise that exists in what is a very noisy industry and really help you understand what you need to grasp onto, right? What are the core things that you need to be tracking? It's sleep, it's how you're recovering and adapting from external stress, and it is how you're building and managing cardiovascular load. And those are the three things that we track at WHOOP.
I love that. I think that allows us to be very focal and intentional in what we do in our daily lives, whether it's with our health, how we interact with others in relationships, playing tennis, right? Because we all do that so well. We've got time to answer more questions from the audience. So let's see what we have submitted through the online system. Okay, I think I'm going to punt this to Madison and Sloan. Given the negatives of social media, do you still absolutely feel like you need to have those platforms? And is there pressure to have them to maintain public brand business efforts, et cetera?
Is that the look of I'm taking that?
Whatever you want. I'll just add to whatever you say.
I think
Go for it.
I think that there is, this day and age, when we are going to companies and trying to have relationships and partnerships and all of that, social media is a massive part of that now. And it's almost to the point where sometimes they'll only talk to certain people or players or whoever that have X amount of followers and this amount of posting and all of that. So it is truly a part of our jobs at this point. And I think that's just the reality of it. And I would be lying if I said I'm going to get off of all social media tomorrow, because
the next day you'd be back on.
Yeah.
Like, there she goes again.
I would be right back.
Yeah.
So I think that realistically it's a part of our lives and it's a part of my job at this point. So I think just trying to figure out how to manage it in a way that I can mentally and emotionally handle it is the biggest part that I've had to learn how to do. There's certain days where I am like, I can't do it. I don't want to see any messages, or I, at this point, don't go on my phone after I lose matches, because that's just setting myself up to be upset. But just trying to figure out how I can manage it is the biggest thing for me, because there still are a lot of things that I enjoy about social media. Like the reason that it was created was for enjoyment. So
and to connect.
Exactly.
Right.
And I don't want whatever Joe in his mom's basement says to me to take that away from all of the great connections that I've made with all of these other amazing people.
That's well said.
Do you have an addition? It's just ditto.
Agreed.
Say ditto.
Yeah. I think.
Okay, now I have a question, which I'm sure the audience has them as well. What are your anticipations or the best feature that you would say for US Open going into this specific series here?
Well, as long as we don't play each other, I think we're good.
Last year when the draw came out, that was tough.
Yeah, last year when the draw came out, we were actually practicing together, and we had to cancel our practice together on Ash because we found out we were playing each other. Not ideal. So as long as that doesn't happen, I think we're good. We're both healthy.
Knock on wood.
Knock on wood. Both playing well. Maddie made the semifinals last week in Cincinnati, so we're doing well. I lost to Iggy, so we're on the up and up. Whenever we start going that direction together, it's always good. So yes, we're happy. Love it.
Perfect. I have one more question that we had submitted as well. Let's see what that one is. Oh, does WHOOP find any key differences in studying performance health data from women athletes compared to men athletes?
Love this question.
She's like,
get me
Love it. You're gonna
started.
kill it.
She shifted in her chair. We know she loves it.
I'm so excited.
We are not small men. And I think Dr. Jackson mentioned this. You know, there's very little female physiology research, and I'm gonna channel Martina right now, and I'm just say we need a Title IX for research, for female research. There is just, when it comes to exercise physiology research on females, it literally doesn't exist. We are basically, all of the kind of the prescriptions are basically applied to us, and the research has been done on men. So I think there's a lot of room here, but I will say that, yes, there are major differences, and the reasons are because we have different hormones, right? The level of estrogen and progesterone and estradiol in our system is just different, and what that causes is these very profound hormonal fluctuations across the menstrual cycle. So for women who menstruate and are naturally cycling, they're going to experience these incredible hormonal shifts that men just simply don't have. So what that means is there's an incredible opportunity for us, especially during the phase of our menstrual cycle where we are in a low hormone phase, which is our follicular phase during menses and ovulation. We are actually primed to PR. We are primed to take on big volume and big intensity. That's where these gals are going to make the biggest gains, right? In our luteal phase, that's when we are a little bit less primed to take on heavy loads and heavy volume and intensity. That doesn't mean we can't PR, doesn't mean we can't perform, but we need different considerations than a male, for example. Like our core body temperature is going to be higher. As a result, we need different electrolytes. We need different levels of sodium during that time. We are going to be burning more calories during this really kind of effortful phase of our cycle. Right? We need to take on a bit more calories. We're actually slightly more primed for injury during that phase. So we need to make sure that we're getting the requisite sleep that we need and that we're recovering a little bit longer after a hard workout, for example. So yes, and this is all based on the research that we've done at WHOOP to uncover these really core differences. Again, looking at objective physiological data and how that data, the physiology is changing over the course of the cycle is going to really, I think, catapult us into, I think, what is going to be the new norm, which is really menstrual cycle coaching. And really being able to leverage our body's amazing gifts across our cycle to really, I think, maximize our performance potential.
I love that. That's great. Thanks. I don't think I've ever heard, as much as I talk about the menstrual cycle, I've never heard it used in a way where you can use it for lifestyle coaching,
We just
training.
discovered it. We
That's
just
amazing.
published this paper. Yeah, recently. Yeah.
So I want to do kind of like a quick fire with all of you. Michelle, I'm going to start with you. If you had one mantra that you would say for health or healthy living that you would want to share, what would that be?
I think you have to be proactive and own it. Take control of your own health. Like, no one is going to do it for you. You absolutely have to do that for yourself.
Love that. Kristen?
Circadian health is physical and mental health resilience. And I know
I'm gonna write that down so I can go Google it later. But we'll circadian, say it again, so we can write it down.
Circadian health is the foundation of physical and mental health resilience. Circadian health.
Sloan, your face is hilarious. She's like
okay, I'm following. Not really. You're a badass. I mean, yeah, it's great. I just would say advocate for yourself. That's all I got. So
advocate for yourself. That goes with the flow. We're doing a whole flow here. All right. And Madison?
I mean, Sloan kind of stole mine.
Oh, thank God I was first.
No,
you can ditto her since she dittoed you earlier.
Yeah, I'm just going to ditto it. I think advocating for yourself is so important. And I think it's okay to ask questions. And
I like that.
Like you said, going and getting a second opinion, a third opinion, and then seeing all of the information in front of you, I think is really important.
I love it. Well, thank you, everyone. I want to thank you individually, Michelle, Kristen, Madison, and Sloan, for being with us today, and our first panel as well. So I want you to take everything that you've heard, digest it, share it with someone, and make sure that you use these messages to turn it into life-saving and life-changing actions. Schedule your Well Woman appointment today. I'm going to ask everyone before they walk out the door. You can't get anything else today until you schedule. I'm joking. Guys, I'm joking. But, get that on the books. Make sure you call your doctor. One of the tips I actually give my patients is to make it close to your birthday. Like, make it a gift to yourself that you're like, I'm going to do the best for myself on my birthday. And so that's what you can do. Get your mammogram, get your cervical cancer screening, get your STI screening. And on behalf of the hosts, myself, Hologic WTA, I want to thank each and every one of you for being here and paying attention to women's health, and have a beautiful rest of your day.